It is a huge honor for me today to be podcast interviewing Alexandra George. How are you doing?
I'm doing well, thank you.
Who's the famous Alexanders?
Alexander the Great. Right.
And where was he from?
Well, Greece.
Greece, and you're
right.
Greek.
Thank you.
And so I assume, after watching My Big Fat Greek Wedding, that you spray Windex into the crowns before you try them on?
I don't get the Windex thing, but everything else is very true. Like the weird stuff in my lunch and all that kind of stuff.
But you don't use Windex?
No Windex.
So your website is pittsburghdentist.com.
Correct.
Dr. Alexandra George graduated from West Virginia University School of Dentistry in 1990.
Right.
She completed a general practice residency program at the Veterans Administration Hospital in Pittsburgh, Pennsylvania, and has dedicated her professional career to providing her patients with the very best that cosmetic and restorative dentistry has to offer. Dr. George specializes in a high-end cosmetics and TMJ issues pain therapy. She has a true passion and talent for the art of creating smiles that are both healthy and beautiful. With her extensive training and experience in restorative dentistry to repair dental problems, Dr. George is able to correct all your dental problems and make your smile more beautiful and dazzling than it ever was before. Her devotion to being the best in her field is reflected in her constant desire to continue to learn more. Dr. George also attended the world-renowned Las Vegas Institute for Advanced Dental Studies, LVI, for postgraduate education in neuromuscular dentistry, where she completed over 400 hours, becoming one of the selected few dentists in the world to earn the LVI Fellowship Distinction Award. Congratulations on that, Alexandra. This means that all dental work she does, cosmetic or restorative, is carefully planned to ensure that the balance and alignment of your temporomandibular joint is properly corrected and maintained. But one of the more interesting things is your office only has 3 employees.
Correct.
And they're all hygienists.
Yeah.
I'm talking about a unicorn. I mean,
yeah.
Did you write in here, or carried by the tooth fairy? I've never heard of that before.
Yeah, exactly.
So how did that happen?
Okay, so it happened probably about 6 or 7 years ago, because I've been practicing for a while now, almost 27 years, and decided, one, I didn't like the difference between the front and the back. It's not my job, have her do it, all that kind of stuff that happens in the dental office. I'm like, no, this isn't going to happen. So I decided to hire all hygienists. They get paid the same fee as a hygienist.
But there's 4 in this picture.
There's 4. Well, she's part-time. She's also a hygienist.
So you have 3 full-time hygienists.
She just retired. She just had 2 kids, and she's a mommy. But if I need her, she says, call me when someone else is on vacation or maternity leave or what have you. But the other 3 are full-time, and then there's me.
It looks like 5 women in a modeling agency.
Well, aren't you sweet?
My gosh. Can I get a job there? I wash dishes. I'll clean the break room. So how long have you been a dentist?
27 years.
No kidding. 27 years. I just celebrated my 29th yesterday.
See, there you go.
27 years.
Yeah.
So I almost don't know where to start on this. So podcasters are young. They're under 30. People our age, that's the nicest way to say it, really aren't big podcast fans, but the under 30, they do this. They multitask. They listen to these things while they're driving 1 hour to work, their hour on the treadmill, whatever. So let's try to address this to the 30 and under. I want to get specifics to their question.
Okay.
Their first specifics are, it's confusing because when you go to learn endo, there's not like, well, do you want to learn Sargenti endo or but in most things you just learn endo. Mm-hmm. You just go to an endo course. But they say, well, the first fork of the road they have to figure out is they see neuromuscular camps like LVI.
Yeah.
And they see CR camps like the other Greek, John Coyce. I'm surprised you didn't go there. The Greeks don't stick together.
We kind of
So should they go Greek with Coyce or Greek or non or so answer that question because when you study occlusion, you see big advertisers, Pankey, Dawson, Coyce, the Frank Spear Center, and then LVI, Bill Dickerson. So why did you go neuromuscular as opposed to, say, Dawson, Coyce, Pankey?
It's kind of a weird story because I almost ended up there by accident because I was at a conference in Vegas, and you know how you go and they have all those booths everywhere and they have all those institutes around. So I started going like, why are you better than them? Why are you better than them? And blah, blah, blah. And I stopped at the LVI one, and this woman said, you go, it's going to change your life. And I said, yeah, right. So I was young, I was a mom, and I had 2 kids at home. My husband happened to be with me in Vegas that time, and I said, it's going to change my life. And she said, yeah. And I went, okay. So I went to the other ones. Nobody else could tell me that. They're just like, yeah, we do great cosmetics, we do great work, and you'll be doing full mouth cases, you'll be doing this, that, and the other thing. And so went back up to the room, told my husband, I got to come back here because I'm going to go to this place, and Las Vegas Institute.
What year was that?
That was in, oh my gosh, I think 2005 or 4.
So that was before the was when it was in Bill's office?
No, it was out in LVI.
Oh, you already had the building?
Yeah, it was just there. So so the lady said it was going to change my life, right? So I get back to the office on Monday, and I called out there, and still not knowing it was neuromuscular. I didn't know that. I just wanted to do nice cosmetic work. I wanted to do magazine quality work, right? So I went back and I called, and I said, hey, I met blah, blah, blah at your booth, and I want to come out and take a course. And she said, okay. And I said, they said it was going to change my life. And she said, it will. And so I said, okay. So she told me how much it was, and I went, what? And she said, it was like $10,000. And I thought,
$10,000 for 1 week or one course?
It was a course, and you went out twice. And I had to take a patient. So I had to take the patient out there. You have all these expensive, and I was like, oh, God. And I said, okay. And I said, well, if it doesn't change my life, can I have my money back? And she kind of didn't know what to say. She said, no. I said, well, if you're pretty sure, I'll do it. So I did it, took a patient, and we just did at that time, I just did some cosmetic work in the front. Well, I'm sitting in this lecture, and then they're talking about neuromuscular dentistry, and I'm like, what the hell is this? Never heard of it. They never told you any of that in dental school. And I'm looking around, and I'm thinking, are these other doctors as lost as I am? Like, because I never heard of it. So then at break, I'm like talking to the other people, and I'm like, what's going on? Like, do you guys know what's, I felt like lost. I felt like, oh my God, I wasted all this money. But then as I started listening to the common sense of it and the airway, and I thought, okay, I'm sold. Then the headaches, and then I went back. I don't want to get emotional.
No, please get emotional. Please. This is Dentistry Uncensored. You can cry on my shoulder.
There we go. Okay. So I went back, and my dad suffered from headaches. Like, he lost jobs. I mean, he couldn't get out of bed. He went everywhere. He went to neurologists. He went to pain clinics and all that. So I thought, I'm going to try it on my dad. I didn't have everything. I bought the little, what do you call it, 10 unit. Forgot it, sorry. I got the 10 unit. I took a bite on him, and I said, okay, let's see if we can help you. So I made him a little piece of plastic, an orthotic like I did, because he had other kind of mouth guards. He had things that never worked, and he was everywhere. So I made him a mouth guard, put it in, and he didn't have a headache for a day or two. And you have to adjust it. It's a therapy. It's not like one and done, and you got to have everything come together. So then after a week, he came up for another adjustment. So I said, how are your headaches? He said, I didn't have any. I said, what do you mean you didn't have any? I said, what do you mean? He said, well, the barometric pressure's been very good, and so I think maybe that's why. I said, okay. So I tensed him again, did a couple adjustments, boom, 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 and he came back in another week or two, and I said, how are you? And he goes, you know what? The weather's just been real. He could not give me the friggin' credit that I helped him. So then I did one on my sister, because she suffered from headaches, and things were good. And you were talking earlier about other things that change in the body, with the blood flow, and he was a cardiac couch potato because he had bad heart. He had an ejection fraction of 13% when I started with him. So he was sick. He's since passed. That's why I'm getting emotional.
That's so funny. We have so much in common. My dad suffered from horrible headaches too. But unlike you, I joined the NRA. I got a gun. I put him down. And he's never had a...
Maybe that's what I should have done.
He's never had a headache ever again.
There you go. But but his cardiac output went from 13% over time because he had to go to his cardiologist every 6 months. Then it went up to 17%. Then it went up to 21%. Then it went up to 23%. And the doctor's like, "What are you doing? You're not losing weight." And he's like, "I don't know." So then I talked to Norm Thomas, who was the physiologist, anatomist that kind of put everything together and connected the dots on what was going on in the body and all that kind of stuff. And he's like, "Alex, you have to write a paper." I'm like, "Norm, I got my own practice. I have a husband. I have 2 kids. And I don't know the first thing about writing a medical paper. Really. But the way you align the body and you open up the blood flow to the brain, to the heart, and all that kind of stuff. But, so that's how I got into it. Just kind of.
And what year did you get out of school?
90. Well, you pay attention. You read that.
1990.
Right.
So, I'm trying to get to, you walk out of school in 1990, and then you end up I did a residency. The only person I know who's a dentist, who all her employees are hygienists.
Yeah.
Talk about thinking outside the box. Where did you get this idea? Obviously, all your other homies all had 2, one receptionist, 1 hygienist, 2 assistants. How did you go from walking out of school? Yeah, walk us through that journey.
Oh, wow.
What did you do in 90 when you graduated from school?
I did a residency for a year. Then I looked for a practice that was for
Where'd
sale.
you do a residency?
Pittsburgh.
Pittsburgh?
Veterans Hospital.
So you went to dental school in Virginia.
West Virginia.
And were you from West Virginia?
Yeah.
Okay.
Yeah.
So then you did a residency in Pittsburgh.
Correct.
So you probably fell in love there because you stayed in Pittsburgh. Is that right?
Yeah. Well, Pittsburgh is like an hour from where I was from in West Virginia.
Okay.
So it was real close, and so I got to be close to family and what have you. Yeah.
So you did a residency. Then after residency, what did you do?
I looked for an office, so I would ask anybody under the sun. And I was in debt when I got out of school. We didn't have a lot of money. I worked through college, student loans, whatever. And I would ask anybody I knew if, this is kind of a funny story. Okay. So I'd ask anybody I knew if they knew of a dentist that was selling their practice. So I got in with this fella who was wonderful. And he was an older guy, and he was 62 at the time, and he said he was going to retire. So I said, okay, I'll go in with him. So about 6 months into it, I'm like, "Nick, are you going to retire?" "Oh, Alex, you're too young for this. Oh, you don't want this headache. Oh, ha, ha, ha." And so I went home, and I told my husband, I said, "You know what? He's not going to sell me that practice."
Okay, but let's stop right there, because these guys, 20% are dental school, the rest are under 30.
Yeah.
Every dentist that you work for that says he's going to retire in 2 years.
Never did.
Well, never. No, they all will know. That's the oldest. They might want to retire in 2 years, but in 2 years later, their truck breaks down. They need a new F-150. Their wife wants to go to Europe. The kid just flunked out. It never stops. So, you've been a dentist for 30 years.
Yeah.
How many times does a dentist say, "I'm going to retire in 2 years"? When does he actually retire?
Yeah, no, yeah. I know. It took him another 14, I think.
Yeah, another 14. That. So don't, monkeys say one thing and they do another. They never say what they never, their actions never follow their words. Right.
So then, when I figured that he wasn't going to do it, his business was busy enough for a dentist and a half. So I didn't work every day. And then I worked at some clinic another day and what have you. So I was home one day, and I didn't have kids then because I was 26, 27, whatever.
So this is back when you're still a genius.
Yeah, right.
Had no children.
Right. I knew everything. So I called my husband at work and I said, okay, I got to find a practice. And he said, okay, Alex, I'm really busy. And I said, you're not understanding. I need to find a practice. I need to do this now. And he's like, I got to go. Tick me off, right? And I'm like, okay, bye. So I thought, that son of a, such a nice guy. And I said, I'm going to show him. I'm going to find a dental practice. So I picked up the Yellow Pages, and I thought, okay, Wexford, which is north of Pittsburgh, that's a nice area, so I've heard. Never been up there, never drove up there. And so I was looking in north of Pittsburgh, And I opened up and I thought, I'm not going to find a man's office because, I was this young girl working in this older gentleman's office and I never knew anything. I'd tell people they needed a crown and they'd say, why? I've been coming here and it's patched 20 million times. And I'd have to call Nick and I'd say, Nick, tell her she needs to get a crown. Like a crown. That's all. So I had no validity because I was just this young chick and what did I know, right? Which I thought I knew everything. But so I picked up the Yellow Pages and I thought I'm going to call a woman's practice. And I called this woman. Her last name was Edgar. She has since passed, but her last name was Edgar. And I said, hi, this is Alex George. I'm a dentist. I heard your practice was for sale. And she said, what? And I said, I heard your practice was for sale. I'd like to look at it. And she goes, hold on. And she puts me on hold, and I'm like sweating under my armpits. I'm thinking, oh my God, what am I doing? I'm sitting here lying. And I said, well, can I come see your practice? She goes, how did you hear it was for sale? And I thought, I'm lying. I said, well, there was a women in dentistry meeting, and your name came up. And she goes, nobody knows it's for sale.
You didn't know it was for sale?
No, I didn't know.
So you
I was just
this
cold calling the first woman I saw in the Yellow Pages.
So you wanted to buy a woman's practice?
Right. Yeah.
So you start cold calling women's offices and saying you heard
and
it
she was the
sale.
first one I cold called.
And how old were you the first time you heard the doctor tell your mom that your daughter was crazy?
Probably 3.
Were you 3?
But yeah, that's my earliest memory, actually.
So you started cold calling women dentists.
Yes.
But I want to back up just before you finish that story. How were you smart enough to realize that everybody goes to Pittsburgh and you wanted to get out of Pittsburgh? And how far north was this out of Pittsburgh?
It was only 13 miles. I have no idea how I was that smart.
Okay, so it wasn't really rural.
Lucky.
It was more like a suburb.
Well, it was rural at the time, but now it's really growing, and it's one
But
of
were
the,
you looking at it rural as less?
Well, this is
dentists
what
per
I
population?
did.
Okay.
This is what I did. So I went up and I met with her, and I fell in love with the office. But she had 2 offices, one with 80 patients, and one with 80, and one with 2,000. That was like 10 miles down the road. And of course, just out of dental school, I couldn't afford the 2,000 one. I said, look, I'll take this one. It was in a little house. It had cedar walls. It was really cute. And it was in the suburb. And I said, I can buy this one. I don't even know how much you want for it. And I don't know where I'm going to get the money, but I'll figure it out. And I know, right?
Yeah.
And then I said, but I can't afford the other one. And I don't want all those like old headaches. Like I want it to be just kind of fresh. But I sat on the porch of this little office, and I had a little glider on the front of my porch. It was really cute. And I just saw all these cars going by, and I'm like, where are they going? Because I felt like I was in the middle of the country. And I just sat there. And then I told my husband I'm buying this office. And he's like, you are so full of shit. And I said, no, hon, I am. And he's like, Alex, where is Wexford? And I said, it's north of Pittsburgh. And so he drove up when I was working, and he saw it, and he's like, that is a piece of shit. You don't buy it. And I said, no, I got to figure it out. And he says, well, okay, figure it out. So I figured it out. And I bought it, and we actually moved into the basement of that practice because we had no money.
Nice.
Lived there for 3 years, had my first kid there, my babysitter there. Isn't that weird?
No, it's just street smart.
Yeah, I don't know. It just kind of all happened.
I mean, these kids walk out of school and they complain, I have $300,000 student loans. Yeah, you only have $300,000 student loans because some bank offered you the money.
Right.
I didn't have a car in undergrad at Creighton in the first 3 years of dental school. They're all driving $30,000 Honda Accords. Spring break, they get in airplanes and fly. I never got in an airplane.
I know, me neither.
Right.
Right.
They've been on cruises before. I thought you had to be a rich dentist to go on a cruise. These people did it on student loans. And then they walk out of school and they'll go buy a 3,000 square foot home while they're an associate dentist.
Yeah.
And then I look at all the dentists in California. If they were born in America, they come out of school with a $30,000 car and go buy a home while they're working in a clinic. But if they come from Asia or Africa or Latin America, they go buy a dental office and they live in the 4th operatory. Mm-hmm. And they eat, and they don't even have a car. And they make whatever they eat out of a Holly hot pot, and 2 years later they have no student loans. But if you're and you ask them, what are your hours? Well, I mean, here's my phone.
Right.
If anybody
That's
calls
what I
me.
do too.
And you know what they tell me in San Francisco? They say, well, you know, the American-born children, they work Monday through Thursday, 8 to 5. So you know when it's 5 o'clock, because all the American-born children dentists go home, and then they start calling the Asians and the Africans and the South Americans and say, I have a toothache. When can I get in? They say, come on down. It's 8 o'clock on a Thursday night.
Right.
And we do a root canal, build-up, and crown, and they give me their Visa card, and it's $2,500. And I have no overhead because that lady back there feeding my child is my mom.
Yeah.
And that guy over there with the mop, that's my husband.
Right.
And we have no car payment, house payment. We eat out of it's just like, and you go meet that woman dentist born in Vietnam and 5 years out of UAP when all the American-born children had $300,000 of debt, including her. 5 years out, she has no debt, $200 in cash.
Mm-hmm.
And the American-born children, you catch up with them at 50, and they still are paying interest on other people's money at their house, their car pay. They're still buying shit on credit. So I tell people the first thing you should do is not be born in America. That's my advice to you. Try to be born in Laos or Cambodia or India or Tanzania. Just don't be born in America.
That's like too when I first started, and I know this isn't talking about neuromuscular, but when I first started, I was the hygienist, I was the receptionist, I was my assistant, the lab tech, the cleaning lady, you know, the mom, the girlfriend, you know what I mean, everything, until I could afford it. And you know, I'd have patients in the chair and I'd be like, hold right there, I got to get the phone. Like, and they all knew, and I'd run and I'd get the phone, and they kind of all liked it. You know,
course they liked it.
It was.
Now, when your husband was down in the basement, was he tied up down there, or was he free?
And sometimes, but we can't get into that.
Was he free to walk around, or is he still down there? Should I call Domino's and send him a pizza? Or, so I love it. I mean, you're a unicorn all the way. You woman. I mean, Mac Lee
I love
graduated.
Mac,
I love Mac too.
Yeah.
I just hate his hair. You know what I mean? His hair is just it's too in your face. But you graduated from school, Mac. No women in your class?
One moved from South America when we were sophomores.
Okay.
I had 100 students.
Out of 100 students, there was one. And Dr. Robert Jenkelson graduated. There were no women in his class.
10 in my class.
10 out of how many?
35.
So that's cool. So you're already a woman dentist pioneer. You did a residency. You had your own business 1 year out.
After my residency, so 2 years out.
So the residency was 2 years.
No, the residency was 1 year. So I worked for the other guy for 6 months.
Okay.
So I guess a year and a half.
Okay. Because one of the most common questions they have, I mean, you're talking to 20% dental students, 80%, the other 80% are all under 30. Mm-hmm. Most of them are working as an associate somewhere.
Right.
For someone else, maybe they're working for big corporate dentistry, Aspen, Harlan, whatever. Their first question is, well, how do I know I'm ready to open up my own? I mean,
you got to have the want, and you got to have the gut, and then you got to figure out financially how you can do it.
I opened up mine. I graduated May 11, 87. Opened up September 21, 87. I believe that you have, how many kids do you have?
2.
And how old are they?
21 and 18.
Okay, so my baby's 21. Mine are 21, 23, 25, 27. But I believe there's 2 things you're never ready for, and that's have a kid or start your own business.
Uh-huh.
And it's best to do it just right now, because there's never a good time. And when you're young and dumb and not aware of the consequences. Right. I had 4 boys in 60 months. It wasn't until I haven't slept for about 5 months when I gave myself a vasectomy. You know what I mean? When you open up your own business, you're going to burn a lot of midnight hours and work 7 days a week because, you know, so if you keep thinking about everything you're going to have to go through to have a child and a business and everything that could go right or wrong with that child or business, well, hell, you'd never have either. Right. So I love the fact that you just dove in head first and you said you got to have the gut and the will.
Right.
So where did you get that gut and will? Did your mom and dad, did they own their own business?
No, not at all. My dad was a cop.
Dad was a cop?
Mm-hmm. My mom stayed at home and then she worked in a bank. And, you know, they were just like, make sure that you do something in life that you can support yourself in case things happen with your husband. So I thought I'm going to be a dentist. My mom's like, yeah, can't you think of something else? Because you want to be in people's mouths all day. I said, no, I think I'm going to do that. So that's what I did. And then, I fell in love with it, and I love it.
So let's go back to why, and where did you decide that all your employees are going to be hygienists? Where the hell did that come from?
Yeah,
and you, by the way, you're the only one I've ever met.
Yeah.
You're the only one I've ever met that didn't have an assistant or a receptionist or an office manager.
I didn't start out like that. Like I said, I've only had this like maybe 6 or 7 years now. But
that's more than a prototype. I mean, that's obviously that's working.
It's working, and it's working wonderfully. And I mean, I had 9 employees at one time. Once I got up and I got busy and all that kind of stuff, but there were too much riffraff, too much girl stuff going on, and I don't put up with that. Ask Mac. Like, there's a problem. I'm like, okay, let's talk it out right now. It doesn't wait until tomorrow. You get it out of the way now. But the girls are smart. They want to learn. They like it. They don't get tired with just pick and plaque and doing hygiene. It works. So where I came
So
up
they're
with
all
it,
doing hygiene. They're all like seeing a patient every hour.
they rotate. Every week they're doing a different position. So one week I have someone at the front
One
desk.
hygienist at the front.
Right. And then the next week she'll be in hygiene, and then the next week she'll be assisting me. So they all know what's going on. So
Okay,
when
so you have one front desk, one hygienist, one assistant, who just happen to be all three hygienists who rotate.
And all paid like hygienists. So it's not, if they're doing the assisting job, it's not that they're getting a lesser salary.
Why? But why? So why? Where did that business model come from? Why did you do that?
So I read a book years ago at an LVI that someone did it. I can't remember who it was.
Why did you decide that all your employees would be trained
Because
to the
I
level
wanted
of a
them to
hygienist?
feel all equal. Because when I had different, and the only way for them to feel all equal was for them to be all equal, right? So they all had the same training. Maybe different schools or what have you, but they all had the want to learn more. So they come all the time with me to my classes.
Are they here now?
Yes, they are. They're wonderful. And if you would talk to them, they would tell you why they love it. And so when someone's on maternity leave or someone's on vacation, they all know what lab case we're looking for, what needs to come in. They all know all the intricacies, so it won't be like nobody checked on this to make sure it got ordered or it got. We don't.
So
have
how many
that.
operatories do you have?
5.
5 operatories, and you have 3 employees. Mm-hmm. And they're all 3 hygienists. Mm-hmm. And how long have those 3 been with you?
1 7, 1 6, and 1 3.
Okay, so one of the things you're saying is, well, I don't want to spend all that money training a staff. I mean, I don't want to pay a hygienist if I could get the greeter at Walmart.
Yeah, but we're so efficient.
And number 2, wouldn't it be cheaper for you to fly here, learn everything, then go back and tell them and give them the handouts?
Yeah, I tried that, and I did that once. And when I came back, we were talking about it last night, and Lauren was saying, I remember how frustrated I was when you came back, and I was doing neuromuscular dentures, and I'm like, I had all my things laid out and how it was going to go, and I was nervous, and they're like, you're stressed. I don't like this because I don't know what's in your head. I don't know what you need next. I don't know any of this. And I said, this will never happen again. And from that day forward, they've always come with me.
Well, any dental instructor that's lectured 1,000 times will tell you, by the time they're done it for 30 years, that you go to every lecture, and this half of the room is all individual dentists who all came to save money. And then the other half of the room, every row's an office. Dentist, spouse, front desk, hygienist, assistants, the janitor, every row's an office. And if I picked up the 1041 IRS deal, the guys that bring their whole staff, they take home twice as much money as the ones who come alone to save money. I mean,
I would have to agree.
It's a team sport. And when they say, I don't want to, what happens if we spend all the money educating our staff and they quit? I say, my God, what would happen if you didn't educate the staff and they stayed? That'd be 100 times worse.
Right.
You know?
Yeah. Very, very true. Yeah.
So why I want to ask you another specific question you're asking. So they get out of school, they've had the same complaint since the beginning of time.
Right.
They didn't teach me ortho, I didn't do a case
Right.
of Invisalign, no sleep apnea. I didn't learn nothing in dental school. They don't appreciate dental school until they're our age.
Mm-hmm.
I feel sorry for any dean that has to take 100 idiots off the street and 4 years later give them a license to do root canals on innocent Americans. I mean, that's what a task I wouldn't want. But they're getting pulled in a lot of directions. So you went neuromuscular TMJ, but she's listening to you thinking, I don't know, I got $350,000 student loans.
Right.
Would I pay them off faster if I learned Invisalign, sleep apnea, surgically placing implants, buying a CEREC machine? Why, and so, and here's her really gut feeling. Here's what she really wants. She really wants to pay off $350,000 student loans.
Mm-hmm.
So put on your economic mercenary hat. What if you were 25?
Oh my.
And you just walked out of Virginia
Yeah.
dental school with $350,000 in debt. You're 25. What would you do?
Cry. I think I would cry. That would be the first thing I'd do. I feel bad for them. I think it's hard. I think economically it is going to be tough, but you got to work. You got to just figure out how you can work. You got to work long hours. You might have to work for 2 or 3 people, but you have to. You got to do
What
you
about
gotta
just
do.
getting a job for the oldest dentist you can find, flirting with him, marrying him,
I
and then
think
start
that would
feeding him
work.
bacon and
Yeah.
eggs every morning?
And I
then
think
just
that's a good plan.
Get him to have a heart attack in 3 years. So would you? What do you? Why
Well-
should they learn TMJ, LVI? Go see Bill Dickerson in Vegas.
Well, I
as
don't think
opposed to-
LVI is the only place too that you can learn.
But why that versus first talk about that versus, let's say, 2 things: Invisalign, ortho, or placing implants.
Okay, I went back and learned ortho. So I do ortho in my office, and I do it neuromuscularly. You can do ortho in your office, and you can start and you can take classes with Rondo or Jay Gerber or what have you, and you can start there. That you make a lot of money in the beginning from, but you got to keep learning and going to make sure. But you got to have a want to do that too. Like, some people don't want to sit and bend wires, and I can understand that. I went to learn ortho because none of the orthodontists in my area would do it neuromuscularly once I got my patients out of pain. So you were talking before about neuromuscular, you're always cutting all these teeth down. Well, you're not if you learn other ways to do things, or you can stay in a splint long-term wise. But I went because nobody else would learn, and I didn't. I did neuromuscular orthodontics on myself because I suffered from, I had symptoms. But, so that's how I did it. And that,
I think it's funny how when you go to dentistry, every course is like trying to give you instructions on how to drive. We're here in Phoenix today at the ICMO meeting,
Right.
ICCMO.
Right.
Say what it stands for.
International College of Cranio-mandibular Orthopedics. Did I get that right? There
and,
we go.
And every
Bravo.
and every course is giving you instructions on how to drive from where we are in Phoenix to LA or north to Vegas or to Albuquerque. And I'm still confused, being a dentist 30 years, so 400 years ago, none of the skulls had any malocclusions. And then we always talk about treating malocclusions, and I'm always sitting there thinking, okay, well, from 400 years ago all the way to Lucy, over 1 million years ago, all the bites are fine. And then out of nowhere, everybody's got malocclusions, narrow bites, cross bites.
I don't think it's out of nowhere. I think now we're just maybe getting more educated to hopefully recognize
No, but I mean
problems.
in the anthropological skulls.
Oh, well, yeah.
From
And
400
I
years
think,
ago
right,
to
right, right.
Neanderthal,
Right.
Peking man, Java man, Homo erectus. No, there's no found skull with a malocclusion that's more than
Right.
400 years old. So my first question is, where does shit all this come from? They say soft diet. They say that when you're nursing, I was a nurse as a child because my mom told me that the commercial said that the formula was better than her milk.
Right, that's the same
So
with
my
me.
mom
Right.
fell for marketing, and
Right.
but I guess the nursing, the mammary glands in your face,
Right,
you're
the-
tugging on
this-
it hard.
yeah,
that
yeah, yeah.
changes
Yeah,
the
yeah.
whole bite. The food was really tough and everything. So now we're just pouring in milk from a fake nipple, eating soft, pre-processed food. So we have all that going on. So you got all this TMJ neuromuscular, but again, specifically, then you talked about ortho. When you said ortho, you said they weren't treating at TMJ. Well, what does that mean? She didn't understand what that means.
Okay.
So
Okay.
you got Americans are weird because here's what I don't understand macroeconomically. So you have all these from 400 years ago back to Homo erectus. There's no malocclusions. So now we just have all these malocclusions, and then the country of 330 million puts all their kids through a 12,000 orthodontist factory, where we just ship every kid through, blows out the canine guidance, the curve of speed, curve of will. We put them all in this factory, and they all come out the other end, and no one's addressing, well, maybe they wouldn't have had a malocclusion if you would have nursed it, but if you whip out a mammary gland in public, you'll get arrested, but if you pull out a pistol, you're in the NRA, and they'll vote for you. So mammary glands are evil, and AK-47s are cool, and the soft diet, the kid doesn't even have to chew, and so my specific question is, what do you think of the American orthodontic factory, where we take our kids, bottled milk, soft food, and then put them through a 12,000 ortho factory? And the reason I asked you that is because you said you got into doing your own ortho because you didn't like the way the orthodontists were treating it according to your neuromuscular standards. What does that mean?
Okay, so neuromuscularly, what you're doing is you're getting in there and you're making balance in the occlusion. Okay, so you're either doing a fixed orthotic, which is something that's attached to the teeth, that you haven't cut any tooth structure down. It's removable, and you can take it off and go back to your natural tooth structure, or you have something that's removable in there. So now you have this balance in this jaw, and you might have had, when you look in and you see someone that has had possibly crowns done or teeth lost, and their occlusion's all nice and wavy, right? So now we've balanced things out for them. So what we do neuromuscularly in a kind of quick, easy way is we make stops on the back teeth and stops in the anterior, so you have a tripod. So now you got the jaw balanced. Well, when you take the orthotic off and you're tripoding that area, then you have open spaces you're not touching in your bicuspids and your first molars. So now you've got to move those teeth down with wires, rubber bands, what have you, or move the lower teeth up, get rid of the cant, and start moving the teeth together, then eventually taking the stops that you had on there that held the jaw off and move those teeth into occlusion, then voila, you're done.
Done with what? What problem were you solving?
We were solving going from the orthotic phase or the balance, have the patient out of pain. Now you don't want to cut down 20 teeth.
So
right.
This all starts with pain.
Pain, well, sometimes it's ear issues, sometimes it's neck issues.
What percent of the time is it pain?
Well, that's probably the highest percent, probably 85, for my patients.
Okay, I treat it differently. When they come in with pain, I just say, okay, do you want Michael Jackson Propanol or do you want Prince?
There you
Percocet?
go. Right.
Why don't you just throw them opioids?
Well, that's not getting to the cause.
And that's an interesting thing with IV sedation when they put kids under. Okay, you put the kid under, but you didn't treat the anxiety.
Right.
And so you didn't treat. It's just like Michael Jackson. Every time he woke up, he took Propanol and just knocked himself back out. You're not solving why are you alive and always want to be knocked out. And it's interesting on anxiety. It's like, okay, well, if someone's really afraid of the dentist and all you do is knock them out, you fix their tooth, but they wake up, their mind still has anxiety. You didn't treat the anxiety.
Right.
Why didn't you talk to the kid, spend some time with the kid,
right,
treat the anxiety, and then he doesn't need to be knocked out every time he goes to the dentist.
Right.
So they're coming in with pain, and
right.
how are you able to build a practice with people in pain as opposed to all the other dentists in Pennsylvania? I mean, why are the people in pain finding you?
Because I get good results, and it's almost like Max says, he guarantees his work. It's almost foolproof, and everything at the time when we start is reversible. Patients that come and see me have been to chiropractors, have been to pain medicine doctors. One of my pain patients is a pain medicine doctor at Pitt, and I got her out of pain, and now she's an ortho and loving every minute of it. She was getting injections in her back.
But is this a big part of your revenue? I mean,
Oh my goodness, yeah.
I mean, what percent of your practice is TMJ pain-related therapy as opposed to fillings, root canals, cleanings, recalls?
85%.
Okay, but she's listening to you saying, well, I'm working for a guy right now, and I mean, if we have someone in pain, it's a toothache, needs a root canal, we mostly do fillings, crowns, cleanings. How did you get to an 85% TMJ neuromuscular pain clinic?
Well, one, it takes time. It's not like that happens overnight, and you study as you go and you grow as you go too. So it's not like you can go and take one class and just learn. Then there's always something else that comes up that you're like, how can I help with that? But when people are coming to see me, they might be thinking it's just, I have a click, I have a pop, I have pain in my jaw. But when you sit and you talk to these patients and you spend an hour and a half with them in the consult, which is not me, that again is my hygienist, so I'm kind of only coming in at 5 minutes and giving them a blessing, but that's a different thing. When they come in and you ask them questions like, do you have ear problems? Do you have dizziness? Do you have nausea? And they have all these other things that nobody connected the dots and say this can possibly be related to the TMJ, the balance of the jaw. And so when we start seeing things like that, and then, you get a lot of referrals from other patients that'll say, well, I went to her because I couldn't fly because my ears were always bad, but the ENT always said that my ears were clear and nothing they could do for me or any medications or anything like that. And then you get the condyle out of that ear where it's been hiding all this time, and you release pressure, get blood flow and all that you can do back there. And they're like, oh my gosh, this is great now. So it's kind of taking what you kind of know from dental school, but not really, and then you have to really be more CSI. Why do you have that? Why? I had numbness coming down my arm.
CSI meaning?
Like you gotta just be like CSI dentistry. That movie CSI where they're trying to put all the pieces
Crime
together.
Stopper?
Yeah, right.
See, I don't allow any of my 4 children to watch that show in the house because I don't want them to get any ideas.
There you go. I know. My daughter could probably kill me too.
So she's listening. If she wanted to learn more about TMJ, what
Right.
I mean, okay, so she's on the first floor. She just walked out of school. You're
Right.
up here on the 3rd floor.
Right.
Walk her up the stairway.
Right.
What would she do first? Would
Right.
she read a book? Would she go to a course? Would she join this meeting that you're at? What would be
I
step one?
would think ICMO is a good place, and I think Myotronics is also a good place because they have a lot of conferences or all over the country and Chicago and stuff like that at entry level, just to see if that's something that interests you. And if it doesn't,
she's never
then
heard
it's
of
okay.
Myotronics.
Myotronics is who the TENS unit that I was talking about earlier. They that's the company that makes the TENS unit and
That's in,
other. That's in Seattle. They're out of Seattle.
Out of Seattle.
Mm-hmm. Yeah. So I would start there. And just do some work and see if it's something that you'd be interested in doing.
I would first have to
I'm
contact. I'm going to contact. I'm on Myotronics. So I'm going to contact them. I'm going to say, "Are you a Seahawks fan?" And if they say yes, then what company would you go to next?
Well, and I know in my office I hold some seminars for the general dentists in my area so they can learn too.
Really, you do that for the locals, and you do that. So, do they turn into better referrals, or
A lot of that's the main thing. You get referrals from them because people don't want to.
And that's the most street smart thing you've heard. So you've been hearing this person's story. I mean, she just gave away a big red flag to who she really is. No, it's huge. I mean, they think they have to get in an airplane and fly across the country to learn something. And you're a dentist. There's 2 million dentists in the world. There's 211,000 dentists in America. These are your homies. And if I wanted to learn ortho, and when I wanted to learn endo, I walked across the street, and half the endodontists and specialists and humans in general thinking fear and scarcity, like, I don't want to teach you molar endo because then you'll do it and I won't. The other half thinking hope, growth, and abundancy, and said, oh my God, pull up a chair, and they want to be a friend, a buddy, whatever. And the most street smart way to learn it is from your homies in your own neighborhood. Right. And if the guy doesn't want to share with you, he's just dysfunctional. And I can tell you that 30 years later, all the dentists who thought in hope, growth, and abundancy and wanted to share with everything, they were happier, they were richer, they made more cash. And all the ones that thought in fear and scarcity, they all had miserable lives and were, you know, when they closed down their office or sold it and moved or died, no one even, you know, said anything. And so you are able to sell your deals because you teach them this. Some may grab it and run with it.
And then
some
I
may
tell
learn
them
enough
that,
just to refer it back to you. It's all yin yang.
But I tell them in the seminar, and I keep it very small, and there's always food and wine, and it's very casual. But I tell them too, if they want to know more, if they want to come hang out with me, like, they can. I don't charge anything for it, and it's a fun way to get to know people in the area, and I can treat their pain patients, or it's no secret, there aren't a lot of us out there. We need more people to help. I mean, you have people coming from other states to come and see you, and hours away to see you. If you had someone in your backyard, that'd be nice and convenient for.
What if you wanted to call you? Could you go to pittsburghdentist.com?
Absolutely.
And would you prefer to email you or phone number, or what would the best way to contact you?
You could do info@pittsburghdentist.com.
Info. And you were born in Virginia?
West Virginia.
And did you leave there and go to Pennsylvania because there weren't any teeth in West Virginia? I mean, for the most part. Were you in search of teeth?
Kind of.
Kind of
I was.
I got to tell you my Pittsburgh dentist story, and I'm really feel silly telling you this because no one believes you're going to think I'm a crazy man. And so I never understood Pennsylvania because it has the best airport and the worst airport in the same state. Philadelphia is one of the most garbage airports in the world, and Pittsburgh Airport is the coolest airport. It's like 4 wings in like some mall. And being a single father of 4, I mean, you got a little layover, you can get in store. I mean, you could buy clothes, you could buy anything. I remember buying all your Christmas presents, Ryan, on a 30-minute layover. Because they're sitting there, you know, a mall would have a lot more poor people than an airport because you can't get an airport unless you have the money to fly.
Right.
So you already got richer people. And so I fly into Pittsburgh and I was lecturing. I think it was going to the Mission Institute. I went there 7 3-day weekends to get my fellowship in the Mission Institute with Carl Misch, placing implants and all that. And I got in a cab. I think it was one of the first or second times I went there. I got in the cab at the airport. And the weird thing about the Pittsburgh airport, you're out in the country, you're out in the rural, you're out in the forest, and you're like, next thing you know, you go through a pass and boom, you're on top of Pittsburgh. I mean, you just go from rural to holy moly. But anyway, we're on the way up there, and the taxi guy locked up the whole brakes and skid. A bear ran out of the woods, grabbed something right at the edge of the interstate, turned around and jet back. And the guy's like, "Oh my God, was that a bear?" I'm like, "Well, what else could it have been? A rabbit?" I mean, and the taxi driver was like a 60-year-old man saying, "There's no bears out here. I've never heard of a bear out here." So then I go tell Carl Misch the whole story, and they're like, "No, you must have saw something else." It's like, okay, I'm from Kansas. It wasn't a cow. It wasn't a horse. It wasn't a goat. Bigfoot. I'm going through all the animals. No, it was a big ass. Black bear hauling ass to the edge, picked something up, dead stop while we're skidding on the brakes, turned on a Volkswagen. Have you ever heard of a bear sighting near?
Oh yeah.
Have you really?
Huh.
Yeah. Yeah, that was the craziest thing I ever seen in my life. Crazy. So are you still doing ortho?
Yes.
Okay, since you and I have been out of school for 30 years, the biggest change in ortho is just simply, and the biggest brand would be Invisalign. In fact, in my 30 years of dentistry, I've never, when I got in, there was already Crest, Colgate, Listerine. The biggest consumer brand I've ever seen in my 30 years was the creation of Invisalign.
Sure.
And when you go, I mean, Ryan and I, in the last 4 months, we've eaten in restaurants in Tokyo, Singapore, Malaysia, Indonesia, South Africa, Soweto, London, Paris, Glasgow. Waitresses at bars at every one of those deals, you tell them you're a dentist, they go, "What do you think about Invisalign?" It's like, how'd you hear about that in Malaysia, Indonesia? I mean, so do you do Invisalign? Because that's a very common question and that you're competing with, because she's wondering, I got $350,000 student loans, would Invisalign be an easy way to pay that off?
So I don't do Invisalign.
Why?
Well, maybe I don't know it well enough.
It's Dentistry Uncensored, just say it.
Yeah, well, I don't know it well enough, but a lot of my patients after having Invisalign I see in my office for pain, because they have those liners in there that come over the occlusal surfaces of the upper teeth and the lower teeth, and a lot of times their teeth won't fall into place and touch real well, so they start to get shifts and jaw problems.
And most of the orthodontists, I say, it's the 80-20 rule. They say 80% of all my cases are fixed wire brackets that do what I need to do. And the 20% Invisalign, I mean, come on, let's be crude and rude about it. They're simple aligner cases, cosmetic, you know, it's not.
And Tom, do you do Invisalign?
Yeah.
So, see, he knows more maybe how to handle it than I do. And maybe for the anterior, I'll do some aligners, like bioliners, which is like an Invisalign, on anterior teeth if I'm just trying to do you do a lot of neuromuscular with Invisalign?
Yeah.
Do you? See, I don't know how to implement that yet. So I do the wires. Honestly.
And then just a couple more. I only got you for 5 more minutes. Should she buy a CEREC machine? And the reason she's asking is, I've got $350,000 of student loans. If I buy a CEREC machine for $150, a CBCT for $100, and a BioLace for $85, or a Lanap laser for perio for $135, she could buy 3 things and double her student loan debt. And she's nervous. I mean, she's 25 and $350,000 in debt. Does she need a CAD cam, a CBCT, and a laser?
Not at this time. If she has all that other debt, I wouldn't do it. If you have all that other debt, I don't have a CEREC machine. I like my lab work. I have a Trios that I use to scan, but I don't have a CEREC.
Trios from 3M?
Yeah.
So you have a 3M Trios oral scanner. And what do you use that for?
I use it for ortho models. I use it for my crown and bridge cases. I use it for regular study models. I use it for everything. It's always.
And why did you switch from an Impergum by 3M SB?
I'll still
and
use that every
tray
now and again,
for
but
Trios?
I like it. It's quick, it's easy, and it's accurate. So I like it. But you don't have to do that either. If you've got all that debt, just stick to the 3M. I mean, why do you want to
it's
go
weird. They
keep
always tell
going
me
all
about
that?
They always tell me about how stressful their student loan debt is while you're at a restaurant and they're eating a $75 dinner. And then you walk out to them. We had that one the other night. Walk out and they get in their $78,000 BMW. And I said, dude, when did you get out of school? A year and a half ago. So you're in there telling me about all this student loan debt. Where the hell did you get that? Oh, well, I'm leasing it.
Right.
You're like, you're leasing?
Right.
You're
Right.
leasing a $70,000 BMW? And that only happens with the kids born in America. I shit you not. And so when you have these politicians say they're against immigrants, yeah, I'm against. I'm against the American-born children. I'm the only one that's out there saying, no, I want to build a wall and throw all the kids born in America on the other side, and let all the immigrants come in, so we
Yeah.
get some work done.
So, and this happens a lot, like you said, with Americans. So I have an office that has 4 operatories in it, beautifully done, skylights, custom cabinetry, but I built another office right across the parking lot that has 5 operatories, and that's where I work out of now. So I'm trying to rent this other office to a specialist, an orthodontist, a periodontist, a oral surgeon, what have you. And I met with a periodontist, and I said, look, everything's here. You have intraoral cameras, you have the monitors, you have the chairs, everything's wired. Come and open up your practice here. Well, I think he had about $400,000 in debt. And I said, well, okay, do you want to have your own practice, or do you always want to work for somebody else? And he said that, he'd like to have his own practice. I said, well, it's going to take hard work. He goes, but if I come here, I'm going to have to take another $100,000 out in loans because I'd need a CBT, and all this. I said, you know what? Have them walk across the lot to my office. I'll take a cone beam on them. And I said, why do you need that right now? You have everything. You have everything. Everything's there. The x-rays, everything is there. I said, you have everything. This is turnkey. You have the waiting room furniture that's nice, everything, fireplace, everything. And he's like, well, then I have to hire this, and this. I said, you can work. Like, you don't have to do all of that. So I have an empty office sitting there waiting for a specialist. I said, I'll give you 6 months free rent. Like, I don't care about this equipment anymore. I said, this is a gift. And he wouldn't take it. But he was driving an Audi and wearing Ferragamos. There you go.
All right. I remember when I bought my first pano machine, you know why I picked the Plan Mecca over the other ones? This was in 1987. Because the Plan Mecca had the new upgrade thing where their pano had a R on one side and an L on the other. And I thought, that's the hottest freaking feature I've ever seen in radiology. I'm buying that one. How cool was that? But yeah, it's people are weird. But hey, I just want to tell you seriously, thanks for coming on my show. I think you're amazing.
Oh,
amazing
thank you.
Stories. They can info@pittsburghdentist.com.
Yep.
Alexandra the Greek. Alexander, do you want to go by Alexandra the Greek or Alexandra George?
Which I like the Greek. I like Alexandra the Great.
How about Alexandra
Queen.
the Great?
Queen Alexandra.
Queen
There we go.
Alexandra
There
the
we go.
Great.
Thank you.
Queen Alexandra the Great. Thank you so much for coming on my show.